Today I'm going to present a case study of a patient who has a 2-year history of hip pain and give you an explanation about how they were helped by understanding what the basis of their pain was and how they could reverse it. Hi, I'm Drew Coverdale. I'm a physiotherapist and author of The Pain Habit. I help patients change and let go of persistent pain. Welcome to the Pain Habits YouTube channel. If you're interested in seeing more videos like this, then click on the subscribe button, and if you've got any questions or comments, then pop them below and I'll do my best to answer them for you. This is a recent case that I've seen in clinic, and the patient's kindly agreed to let me share details. It's anonymous, but I'll present the case as it was presented to me, just to give you an idea of what the patient complained of. So it's a gentleman who had a 2-year history of right-sided hip pain. The onset was a tackle, playing five-a-side. I played football a couple of years ago. It felt a sudden sharp pain as he tackled. He was able to continue playing at the time, finish the game, and then had the pain afterwards that was there next morning a little bit worse, and then subsequently stayed despite many different things that he tried. He'd seen quite a few different people. He'd ended up seeing a consultant. He'd had an arthrogram. He'd had an MRI scan of the lumbar spine and the hip. He'd had ultrasound scans, x-rays. He'd had the full lot, basically, gone through private healthcare, and nobody could find anything consistent with his symptoms. Nothing on the scans. He had 2 incidental hernias that weren't causing him a problem and wouldn't give him that distribution of pain. Anyway, because of those ongoing symptoms, he'd got a referral through to see me. So essentially, he'd suffered a soft tissue injury in that moment. We can only assume, because it's 2 years ago, it's healed. Totally healed. It doesn't matter what it was, it's healed. And very fortunate, I suppose, that you can know that everything's been checked for anything that might have been sinister to cause those symptoms, so that the nasty stuff's ruled out. But also some of the stuff that's found in MRIs, that's x-rays and things that's normal, that people chase treatments for and surgery for, that are found in normal people, they aren't there either. But his pain was real. He couldn't run without pain, and yet he continued to run. He couldn't play football anymore. He'd not been able to play for a couple of years, really. He had a daily restriction with the things he wanted to do in his life. Interestingly, he had some traits of just wanting to keep going despite not being able to, and he'd push past and he'd carry on despite it, and he'd have pain during the run and do it anyway. He couldn't do that with football, so you could easily see he was quite a driven guy, and that's common with a lot of people that develop persistent pain. But basically he had no other options from an orthopaedic point of view, and he thought he'd exhausted his options, but was giving physio one last chance. The best thing he could do for himself was an occasional foam roller. It'd help in the short term, which fits with another video I'm going to do. But then it would just come back. So the pain would just come back all the time. In fact, it was there all the time. There was a constant ache, and it would vary depending on what he did. So when you look at him objectively, there's physical findings with this. Real simple physical findings. So you look at flexion, extension and side flexion. All of them are limited by about a quarter to half in different directions, and all reproduce his pain. If you've heard of the slump test or straight leg raise, they were positive too. He had some paravertebral muscle spasm on the right hand side of his back. So the physical findings that anyone can see, whether you're a physio or not. It hurts for him to move, but I know structurally the tissue's healed. He is still in the fight or flight state because he's seen some brilliant people, had some amazing tests and the technology behind them, and showed him diddly squat, and he hasn't got the answer. Now, the more failed treatments you get, it pushes you further down the potential to get persistent pain, or for that pain to stay, because it becomes more stressful when you go to see someone that you trust and you think it's going to give you the results you want, then it doesn't. It's disheartening. It's stressful, and that stress drives the mechanism behind the pain beyond the one that was initiated with a physical injury. In the time that the physical injury is healing, which is about 3 months for everything, that analysis of the pain, the worrying about the pain, the concern that it's not responding and getting better, then the failed interventions that start to happen and the failed tests that don't bring the answer start to create this cycle of stress, pain, stress, pain. So how can I convey to him that he's fine? Well, firstly, just told him that there's nothing sinister and that he's had all the tests to confirm that. There's nothing he's got that's going to kill him. And I'd examined him so that I can see his restrictions, I can see his pain, if you like, and it's real. But I said to him that the basis for that is no longer the tissue damage that started it all. It's more to do with the fears around it and why his fears were there. And it explained that and the mechanism, how that persistent pain becomes dominated more by the emotions attached to the movements than actually the movements themselves. So I only saw him a week ago and I've had an opportunity to review him since then. But I did no more than get him to take 4 or 5 deep breaths through his nose and out of his nose, count to 5, following me as he did it. And then I re-examined him. His movement started to improve straight away. Started to click behind why the mechanism of pain had stayed, and it made some sense to him. Now, belief is a massive thing with any treatment. And I'm just another person telling him something different. So it's a really tough situation sometimes to challenge someone with a very different belief to the one they've held for so long about their pain. But I think the easiest way to present it sometimes is to say, well, all those beliefs you've held, or the beliefs of the other people that have tried to help you, I said, they can't be right because you're not any better. So it's just getting them to buy in to the possibility that this approach can help them. So it's giving them thoughts that make sense, thoughts that actually can trigger optimism within them, showing them a breathing rate and getting them to do it straight away. Get them to do it. Breathe in this pattern. And often they haven't breathed like that for a long time. Get them to then to move, but set the boundary quite small. And the feeling and the output is different pretty quick. Now, by the end of the session, he was pain-free, gone completely pain-free. Now, the change isn't always quick like that. When it is, it's crazy because they haven't done any technique at all. I've simply told him he's safe, told him he's going to be okay, told him there's nothing seriously wrong with him, and said he's going to be fine. Now, those aren't words that he's been telling himself at all, or anybody else has been telling him in the last 2 years. Once he starts to hear them and almost repeat them unconsciously back to himself and engage in the thought pattern and breathing pattern that comes with it, the movements come automatically. It's crazy when you see it. So he left pain-free. Now, I actually reviewed him yesterday, a week after I'd first seen him, and he came to the room and said, did you hypnotise me? And I said, no, I simply told you that you were safe. You are going to be safe and you make a full recovery. He ran the 5k that he's never been able to run pain-free for 2 years. He ran pain-free. And he ran the next night 5k pain-free. Now, I could have predicted him doing that because people often chase the pain, or they're so driven they're excited to get back to what they've always done. So there's a risk there that they kind of trigger the symptoms again through that enthusiasm. But he got that completely. He recognised that he needs to again condition his body physically after not being able to run comfortably for a couple of years. Then he does have to take it easy. So it'll be reviewed over the next few weeks, but it's going to be absolutely fine. But it does create amazement in people how they can be constantly painful, totally dysfunctional, and in one session, in some cases, can be pain-free. They've just got to be made to feel safe. They've got to know that they have control of that. They have to accept the responsibility for it, and maybe not get too excited on the rehab, and frame any return of that pain or sensations that come around that pain that may have previously frightened them and triggered a cascade of thoughts that brings the pain back, and they have to control that. To breathe, think, move in a safe way, and the output is always different. If they repeat that enough, if the epiphany is so amazing, the pain's gone immediately. If it takes a little repetition, then that repetition must come with the right kind of emotion. And if it does, pain-free as possible. Thanks for watching this little video today. I'll present some more case studies, because I think when you hear different people's stories, it has more meaning, and everyone I see fascinates me. I hope you find them interesting. Thanks for your time today. Now go and spend a little bit more time to plan the next step in your recovery.